Have you ever felt an unexplained itch? Or maybe noticed a subtle change in your urine color and just brushed it off? It seems like a small thing, right? But what most people don't know is that these little, strange signs might be trying to warn you about something much more serious, like pancreatic cancer. Yes, you heard that right. That symptom you'd never connect to something severe could be your body's way of telling you that something's wrong. Ignoring these signs can be fatal, and the truth is, no one is talking about this. Think this is an exaggeration? Keep reading, because what we're about to reveal could change the way you think about your health. Imagine going weeks with an annoying itch or noticing small changes in your urine color. Most people wouldn't think of pancreatic cancer when noticing something so subtle. But these are early warning signs your body is sending, often ignored because they seem harmless. The problem is that by overlooking these symptoms, cancer can keep growing silently. Now, if someone experiences these small changes and thinks, oh, it's just something minor, that's where the danger lies. Many pancreatic cancer patients' stories start exactly like this, with pancreatic cancer symptoms that are dismissed. Maybe it's time to pay attention to that strange discomfort you've been feeling. After all, your body is speaking to you. The question is, are you really listening? Pancreatic cancer is a master at hiding. It disguises itself with vague symptoms, like mild abdominal pain or a loss of appetite, which could be blamed on just about anything. This makes it incredibly hard to diagnose, making things even tougher for patients. By the time it's found, it's often at an advanced stage, like stage 4 pancreatic cancer, making treatment more complicated. To put it into perspective, some patients discover the disease during routine checkups after noticing signs of pancreatic cancer they never thought were serious. Stories of pancreatic cancer often follow this pattern, a late discovery, when the pancreatic cancer survival rate is already low. And that's when the road becomes difficult, with chemotherapy and intensive treatments taking center stage. Symptoms like unexplained weight loss or that persistent abdominal discomfort can be clear signs that something's wrong. Often, they come along with increased bilirubin levels, causing the skin to take on that yellowish hue we know as jaundice. These pancreatic cancer symptoms, though well known, can still be underestimated as signs of other conditions. Digestive issues, liver swelling, and even back pain are other indicators that the pancreas may not be functioning properly. Pancreatic cancer patients frequently report these symptoms when the disease is already advanced. Understanding these early clues can be critical in seeking cancer treatment as soon as possible. Some people are more predisposed to developing pancreatic cancer due to certain risk factors. Advanced age, especially after 65, is one of the most significant, as is chronic pancreatitis, which causes ongoing inflammation in the pancreas. But that's not all. Those with a family history of pancreatic cancer or those who abuse alcohol also need to stay alert. This combination of factors puts many people in a vulnerable position. On top of that, diet plays an important role. Poor eating habits, rich in fats and lacking nutrients, can significantly increase the risk. Combine this with excessive alcohol consumption, and you've got a fertile ground for cancer to develop. Knowing these factors is an essential step in trying to avoid them and lowering the chances of facing a diagnosis like this. Though less commonly known, some rare symptoms can also point to pancreatic cancer. Issues in the mouth, such as ulcers or changes in taste, may seem completely unrelated to the pancreas, but they've been reported in some pancreatic cancer patients. Another puzzling sign is the enlargement of the gallbladder, which can go unnoticed until a more detailed exam detects it. Abnormalities in fatty tissue, such as hardening under the skin, are also unusual manifestations of the disease. These symptoms, being rare, are often not taken seriously at first. For cancer patients, these details can make all the difference in early diagnosis, transforming cancer stories that could be tragic into journeys of survival and hope. Preventing pancreatic cancer can begin with simple daily choices. For instance, quitting smoking is one of the most effective ways to reduce your risk. Additionally, cutting back on alcohol and adopting a balanced diet rich in anti-inflammatory foods can be a true shield against this disease. Simple things like adding flax seeds to your breakfast or garlic and ginger to your meals make a big difference. For those looking to go further, an active lifestyle with regular physical activity also helps prevent pancreatic cancer. Plus, Choosing foods rich in nutrients and antioxidants strengthens the body against the development of serious diseases. Making these small changes may not seem like much now, but for many cancer patients, prevention stories are what bring hope in the midst of so many struggles. Are you going to keep ignoring the signs your body is sending you? It might just be an itch today, but what about tomorrow? The knowledge you've just gained could be the very thing that makes all the difference in your life. Have you thought about how life-changing it would be to detect something so serious early on? Prevention and paying attention to the small details can save lives, and now you know it. So, what will you do today to take better care of yourself? Leave your questions in the comments, share your story, and let's go on this health journey together. And don't forget to subscribe to the channel and turn on notifications so you can keep learning about how to protect yourself and the ones you love.